Good morning, good afternoon, and good evening, ladies and gentlemen. Let me introduce myself. My name is Dameitha. I'm a student of LSPR Communication and Business Jakarta, under the supervision of Mr. Charles Bonar Sirait as my lecturer. And in this video, I'm going to talk about bipolar disorder.
Maybe you've heard the term bipolar used to describe someone who's moody or who has mood swings. But this colloquial use of the term is really different from bipolar disorder.
So, what is bipolar disorder? Bipolar disorder, which used to be called manic depression, is a serious mental illness that causes a person to have dramatic shift in emotion, mood, and energy levels, moving from extreme low to extreme high. But these shifts don't happen moment to moment. They usually happen over several days or weeks. There are a few different types of bipolar disorder, but there are some common features. First, the low moods are identical to those in related disorder. Major depressive disorder, also known as unipolar depression. Individuals with this can feel hopeless and discouraged, lack energy and mental focus, and can have physical symptoms like eating and sleeping too much or too little. But along this low, the thing that sets bipolar disorder apart from unipolar depression is that individuals can have periods of high moods, which are called manic episode or hypomanic episode, depending on their level of severity. In many states, people can feel overly happy or optimistic with really high self-esteem. And over the surface, this might seem like very positive characteristic, but when individuals is useful manic episode, these symptoms can reach dangerous extreme. Causes of bipolar disorder is like most mental health conditions, the exact underlying cause of bipolar disorder is still unknown, and there is no single bipolar gene is identified. But it is thought that there are genetics and environmental factors that play a part. For example, one of interesting clue is that people with their family members who have bipolar disorder are 10 times more likely to have it themselves. Another clue is there some drugs and medication can trigger manic episode. It's also worth mentioning that people with bipolar disorder often have other disorders like anxiety disorder, substance use disorder, ADHD, and personality disorder as well, making diagnosis and treatment are really challenging. Bipolar disorder commonly begins to show itself in the late teens. Bipolar disorder in teenager years is more serious and it's often more dangerous than in adults. Young adults with bipolar disorder are high risk for suicides. The symptoms of bipolar disorder can be difficult to identify in children and teens. It's more hard to tell whether these are normal ups and downs, the result of stress or trauma, or a sign of mental health problem other than bipolar disorder. Children and teens may have distinct major depressive or manic or hypomanic, but the pattern can vary from that adults with bipolar disorder, and the moods can rapidly shift during the episode. Some children may have periods without the mood symptoms between the episode. To be diagnosed with manic episode, you must experience these symptoms for at least 1 week, or that cause you may be hospitalized. You must experience these symptoms almost every day during these times. Major depressive episode, on the other hand, must at least 2 weeks. Even though there is no cure for bipolar disorder, identifying and treating individual is really important, since there are really danger that the person could harm themselves or commit suicide. One of the oldest treatments is also one of the cost-effective treatments, and that's lithium salt. Lithium acts as mood stabilizer, smoothing out when high and lows they experience. That said, it is much better at treating manic rather than depressive episode. And so individuals who take it often have to take other medication as well, which can be problematic since some antidepressants like the SSRIs can trigger manic episodes in individuals who are predisposed to them. Other treatment options include antipsychotic, anticonvulsants, and benzodiazepines, but many, these including lithiums, have side effects that can be severe and lead to non-adherence, which can be dangerous for individuals. Alright, so super fast recap that bipolar disorder is a mental disorder that characterized by depression, periods of lower mood as well as mania, periods of heightened moods. So don't underestimate health problems, especially bipolar disorder in teens and young adults. Thank you for watching.